A first pill form of a GLP-1 drug is hitting the U.S. market. Manufacturer Novo Nordisk announcing Americans can now buy a daily pill of Wegovy, making it easier to take for weight loss than weekly injections.
Just a quick pharmacy PSA, because I feel like it's not talked about as often as it should be. A lot of these medications are marketed as weight loss drugs, but I just want to highlight the way that you lose weight by using something like Ozempic or Wegovy is simply the medication causes delayed gastric emptying, aka you feel fuller for longer, in which then you probably won't eat as much, so you're consuming less calories, so then you lose weight. So while these medications definitely can be helpful for weight loss, it's not a magic bullet or a cure-all, and unfortunately, a lot of people gain that weight back if they ever stop these medications. So if you've been prescribed a medication for weight loss like Ozempic or Wegovy, in collaboration with your pharmacist, your nurse, your doctor, I'd highly, highly recommend you talk to them about behavioral strategies. How you can eat more consciously. So then in the case that if you ever do stop those medications, you can still keep up some good habits to avoid overeating. You may have heard of something called cognitive behavioral therapy, or CBT for short. Now, while we typically think of CBT in the context of co-management of depression and anxiety and other mental health illness, it can also be used for weight loss as well. I wanted to point out a really cool book called the Beck Diet Solution. It's essentially CBT for weight loss. I'm not sponsored. I'm not selling the book or anything, but that's one example you can look into if you're also looking for help with the behavioral aspect of overeating and weight loss.